say on how we're going to meet his commitment of course, directing states to ensure that every American is eligible to receive the vaccine by May 1st, how we're going to expedite it, and how we're going to get to the point where we are having July 4th barbecues. So first, he announced the plans to deliver vaccines directly to up to 700 additional community health centers that reach underserved communities, bringing the total number of community health centers participating in our federal vaccination program to 950. And this is hugely important as we're talking about addressing access, vaccine hesitancy, meeting people where they are in communities, because these health centers are trusted places in many communities where people go and they get regular health services, and so this will dramatically increase that. We're going to double the number of pharmacies participating in the federal pharmacy program. When we first announced this, if you all remember, we announced that it was a pilot program and we're going to see how it went. It's extremely successful, and it has been very effective around the country. And so now the vaccine will be available at more than 20,000 pharmacies across the country. He will also more than double the number of federally run mass vaccination centers to ensure that we reach the hardest hit communities. And he talked about this in the speech, and we've seen these in communities across the country, and many of you have covered this, where you can drive up in your car with your family members, get the vaccine, and it is quite inefficient, and they can reach often thousands of people in these vaccination sites. And also announced the deployment of more than 4,000 active duty troops to support vaccination efforts, bringing the total to over 6,000 in all. So that's obviously a significant increase, and expanded vaccinators, the people who can give these vaccines, to dentists, optometrists, paramedics, physician assistants, veterinarians, and many more. So the last piece, and I announced much of this yesterday, and I think you're all quite familiar with what he's doing next week, but in the for tradition here, next week the President, Vice President, First Lady, and the Second Gentleman will hit the road to talk to the American people about the benefits of the American Rescue Plan. On Monday, he will host an event at the White House on the implementation of the American Rescue Plan. On Tuesday, he will travel to Delaware County, Pennsylvania, as part of the Help Is Here tour to amplify the American Rescue Plan. And on Friday, the President and the Vice President will travel to Georgia to continue engaging with Americans about how they will benefit from the rescue plan. Jonathan, go ahead.
Thank you, Jen. A number of influential New York lawmakers, including Representatives Nadler and Ocasio-Cortez, have now called for the resignation of Governor Cuomo in the light of new allegations of harassment, including one that was referred to law enforcement. My first question is simply this: does the President believe the governor should resign?
The President believes that every woman who's come forward, there have now been 6, I believe, who have come forward, deserves to have her voice heard, should be treated with respect, and should be able to tell her story. There also is an independent investigation that is ongoing, of course, in the state with subpoena power overseen by the Attorney General, and he certainly supports that moving forward. We, of course, have watched the news of a number of lawmakers call for that, but I don't have any additional announcements from here.
A follow-up on this: in light of the investigation, in light that he has had some of his pandemic response powers taken away, does the White House still have faith in Governor Cuomo if he remains in his position, overseeing the response to the pandemic in the state of New York?
Well, we certainly don't want anyone in the state of New York to be penalized, meaning not have access to vaccines, to vaccinators, not have access to funding from the rescue plan. And certainly we will continue to work with a range of officials to get that done and get it implemented. But the President and our COVID response team works with governors across the country, including Governor Cuomo, to implement these plans, and we'll continue to do that.
One other topic.
Go ahead.
There are more than 10 million doses of the AstraZeneca vaccine in the U.S. that can't be administered here, but could save lives in Europe and other places in the world if the company was freed from the obligation to deliver those doses to the U.S. government. The company has appealed to the administration to let them export those doses. Why has the President not agreed?
Well, let me just take a step back here and explain kind of what's going on here. First, as we've stated a few times, but worth restating, the President's priority and focus is on ensuring that the American people are vaccinated. Obviously, he made some significant announcements last night about the timeline of that, and we will have enough doses in our hands by the end of May to ensure we can make that happen. AstraZeneca is also not yet approved by the FDA. We also want to make sure we have maximal flexibility, that we are oversupplied and overprepared, and that we have the ability to provide vaccines, whatever the most effective ones are, to the American public. There are still 1,400 people who are dying in our country every single day, and we need to focus on addressing that. At this time, there have been requests around the world, of course, from a number of countries who have requested doses from the United States, and we have not provided doses from the U.S. government to anyone. So this is not about Europe. This is about our focus and our priority, which we have been very public and clearly stated. And what you're referencing in terms of access to doses, of course, the production, part of the production is through the defense, is enabled because of the Defense Production Act. There is a contract obligation to deliver on the U.S. doses and to fulfill that contract. But any company, AstraZeneca is not a U.S. company. They can also work with, and even if they were, they can work with any country to fulfill and to work on a deal to get access to doses.